Welcome everyone to the 2021 Virtual SMA Conference. This is Sarah from Cure SMA's Family Support Department. We thank you all so much for joining in on our talk today on Taking Charge of Your Health, the Transition from Pediatric to Adult Care. We are grateful to our national presenting sponsors, Biogen, Genentech, and Novartis Gene Therapies for their incredible support of this year's Virtual SMA Conference. Please note that the lines will remain muted during this webinar other than for the speakers. You will find the Chat Conversation tab located on the right side of the screen. You can use this to ask questions throughout the presentation. Also, if you're able to grab a paper and pen available to you, you can participate in scoring on a quiz later in the presentation. We would now like to introduce our presenters, Sarah Stoney, Diane Morrell, Vanessa Batista, and Dr. Bakri El-Sheikh. Sarah?
Thank you so much for having us. Next slide, please. Perfect. So thank you to Cure SMA, and thank you to all my the panelists who have joined me and our parents and patients and caregivers who have logged in to talk about what can be a very overwhelming and anxiety topic, and that's transitioning care. But our whole goal today is to give you information and to empower you so that we can make a lot of those anxieties minimized. We're going to talk about the importance of why transition is so important and why that there's certain points in time in your young adult life when we feel as though it is time to move over to an adult provider and why that is. We're going to identify some of the transition skills that you need before transitioning over to adult care. And we're also going to use a conversation tool to elicit goals of care in one particular neuromuscular clinic. An adult provider will also be on to give his perspective on adult clinics and the differences that you might anticipate once you transition care. Next slide, please. So when you look at a slide like this, it's truly a compilation of what we envision and have heard from many of the patients that we work with when we are transitioning care and having these discussions. The challenge of transition can be described as barriers when block the transition to continuous and comprehensive adult care. So I want you to hear some of these statements and tell yourself, your caregiver, or in the chat whether or not any of these resonate with you. My doctor has known me my whole life. How am I supposed to see someone new? How will I know when I'm ready to go to a new doctor? I can't even remember which doctor does what. Who can talk to my college about my SMA? It just seems so overwhelming. How am I supposed to answer these questions? That's my parents' job. My parents won't let me answer my questions. I thought this was my appointment. No one takes my insurance. Oh, what if I have to call the insurance company? How do I do that? That's a tough one. Am I going to see the same number of doctors when I go to the appointments? I usually see so many people. My mom's always scheduled my appointments. Who will schedule them now? Or can she keep doing that? And who do I talk to about end of life? Or if I've thought about special things that I want done, who can talk to me about that? So we wish that in our hour today, we would be able to answer most of these questions, but the reality is we're likely not going to. But what we hope is that by having more of these conversations and by giving you more information, that we can then decrease some of the anxieties and hopefully be able to help you answer some of these questions with more confidence. Next slide, please. So one of the first things to understand when we're talking about transition is the difference between transition and transfer. Transition is a planned sequential set of supportive steps in care that prepare you to make and handle a significant change, such as transitioning your care from a pediatric provider to an adult provider. The transfer is truly just the point in time when a patient is transferred from a pediatric provider to an adult provider. Responsibility then just shifts from one person to another. And the reason why it's really important to know the difference is that we're not discussing transferring care, because if it was that simple, we wouldn't be here today, but it's not. Transition is a process that takes years in order to prepare all of our patients to be more independent with their healthcare decisions. So that is why we put so much time and attention and try to really start as young as adolescents in talking about transition and really preparing our teenagers. Next slide, please. So why are we talking about transition? Because it is so important. Transition is very important. And like I just said, it's so much more than just switching doctor's offices. Many of the patients that we see in a pediatric facility oftentimes have been followed since the beginning of their diagnosis of SMA. So we understand and we empathize that for these families, that's been decades often, that they've been followed by the same team, the same set of therapists, and the same physicians. So we understand that this is a huge challenge, which is why we want to make it supportive and we want to do it at the right time when it's in the best interest of your health. It truly involves just a ton of personal growth that should develop over a course of several years with you, your support network, and your medical team. New health issues may arise that may either complicate or delay transition, or in fact bring to terms that there's actually new adult issues going on that would be better handled by an adult physician. One of our pediatrics physicians said it's replacing ear infections with high cholesterol, which I think sums up that move that we do at young adulthood, when it's really important to start looking at other factors in the body that are not related to pediatrics. And we want to make sure that you know how to get your healthcare needs met, which is exactly what we're going to talk about today. Next slide, please. So this is a model from gottransition.org, which is a phenomenal resource. If you are preparing for transition, I strongly advise going to their website and using some of their tools. They have all sorts of transition readiness assessments and other tools that are very unique to any individual that is making a transition from a pediatric care provider to an adult care provider. And this specifically is their transition model. So as you can see, again, not as simplistic as just faxing records and making an appointment at a new doctor's office. It really starts at the top, which is knowing your provider's policy, knowing that what institution you're going to, what does that transition plan look like for you and for even yourself and other departments throughout the institution. We want to monitor your progress. How are things going? How comfortable are you feeling having these discussions? A lot of that can be done through tools that we call transition readiness, which Diane's going to talk about later. These transition readiness assessments are assessments that can kind of gauge to tell yourself, your caregivers, and your care team exactly how comfortable you are discussing certain things with your physicians and being more in charge of your health care, whether that's scheduling appointments or ordering refills for medications. Planning is absolutely key for transition. We want to plan ahead and try to identify any barriers that may be in the way, one of which being when we turn 18, and we'll talk about that one in a little bit. And then once the initial transfer of care starts, we get you over to an adult care provider. It doesn't stop there. All of this care and transition still continues to work. In an ideal model, we're shooting for also to be involved with the patient after they've gone to adult care medicine to ensure that there are no loose ends, that the physician has all of the information that they need, and that they feel well supported in their new place. Next slide, please. So starting by knowing your center's transition policy may seem like a very simplistic request, but it's actually a little bit more complicated than you'd imagine. So some pediatric institutions have set guidelines that that have certain age cutoffs where you have to move on to an adult care provider, for example, at age 18 or age 21. If your institution has a policy like that, then you know what to prepare for. For agencies or institutions that do not have policies like that, then it truly is typically up to the department and the care team to make what's in the best decision for the patient. These questions can start in early adolescence because it's going to help you prepare for the years ahead. There's many benefits to starting early, because with this being one of the first steps and knowing, okay, we have X amount of years to be able to prepare for going to an adult care, why don't we start preparing our young teen or adolescent being a little bit more involved in a healthcare plan? And there are ways that we can do that Diane's going to talk about a little early on. But something as simple as having your adolescent come up with questions that are 100% their questions for the doctor when they come in, or learning how to call and make an appointment, are all things that could start them off small and taking small steps into learning more about their healthcare plan. And despite being within the same institution, transition policies could even change from provider to provider. So many of our patients with SMA see multiple providers within our institution at CHOP. So just because we may have a specific transition policy in neurology, it may not fully mirror the transition policy of our pulmonary or cardiac or ortho counterparts. So it's always good to talk to each team to ask them what the transition plan is. Behind the scenes, we're of course trying to work together and align to try to make the transition work for you. So some families prefer to transition one at a time, some want to do it all at once. Honestly, this is something that we want to make sure works best for you and your child. And some questions that you can ask to your healthcare provider specifically around this policy. What age do I need to change to an adult doctor? When do I start to meet with you on my own? When can I start asking my caregivers to step out of the room? And what do I need to get started for adult care? And how is it going to look different? Am I going to see the same people when I come in? And do you have any checklists or tools that you think would be helpful in preparing me for that? Next slide. And of course, we want to monitor your progress as you're going through this. Transition plans should be reviewed every visit, but at minimum once a year. And that check-in can consist of a transition readiness assessment, or really to just review any goals that you and your patient or caregiver have all set up to try to work on over the past year. By age 16, you can really start asking your doctor questions, and remember that it's okay to have your parents or caregivers to step out of the room, and you are allowed to have some private time with the physician. You really want to start reviewing and preparing for changes at 18, which we're going to talk about on the next slide, because things do change at 18, but it's also not as scary as it has to be. And really learn how you best receive information. So you may actually go to a doctor where they will ask you questions like that. Do you like to see things done for you so that you can learn visually? Do you prefer to read about things so I can give you a paper to read? Or do you like to listen so that you hear the information? If you already know that about yourself, that's really valuable information to your medical care team, because that can also guide them on how to best give you the tools that are going to be working for you. So some questions that you can ask. Starting to get a copy of your medical summaries and emergency care plan. This is also great for when you're preparing to go off to college, which may or may not be in a new city, which also may mean new healthcare local providers than your typical team. When I turn 18, what rights in healthcare do I need to know about? If I need help making my own healthcare decisions, who can I talk with? So excellent question, and definitely something you want to ask with your care team, and they'll be able to explain the legalities of turning 18. The reality is that when you do turn 18, you are a legal adult, but it doesn't mean that your parents can't help you with some things, and we're going to talk about that later on. Will you help me move to a new adult doctor? Who do you recommend, and who can really take care of me because of my disease? Do you have any suggestions of adult doctors, and most importantly, do they take my insurance? Can you call the new doctor and help me set up an appointment for my first appointment? Will you help send my new doctor all of my medical summaries and everything that they need to know? All great questions that are completely appropriate for you to ask your current team. Next slide, please. So planning ahead. So let's talk about the age 18, which is probably also when I get the most questions from our patients and parents. What happens at 18? While there are some things that legally do happen, of course, at 18, we recognize that a person is an adult, which means that they have full access to their own medical information, and that truly, in order to share that information with another person, there would need to be a signed release form. So that's something that can be done in a medical office just during a regular visit. So if you're approaching the age of 18, or you already have, and you do want your parents involved, being able to call the doctor to get information, whether it's about medications or the care plan, you can ask your doctor to sign what's called a HIPAA privacy consent form, and sign it saying that your parents are allowed to have access to your information. So that can also help ease the anxiety if you're concerned that your parents are no longer going to be able to help you. Because of course, just because you are an adult doesn't mean that overnight you wake up on your 18th birthday and you understand everything about healthcare. That will not happen. So I wish it was that easy, but it is not. So we certainly understand that parents and caregivers and other support team members are really needed despite our kids turning 18. When you turn 18, you're also going to start hearing other terms, which is something that we've actually changed in our young adult clinic at CHOP. In adult medicine, when you're typically checking in for an appointment, you often hear terms like power of attorney or advanced directive. You get asked if you have an advanced directive and if you want information on it. So in our young adult clinic this past year, we actually really made a focus of discussing advanced directives so that patients, regardless of whether or not they were interested in having one, had all the information about what that was. So that's definitely a term that you want to learn about so that you at least know what it is. And start the discussion about which adult care providers you may want to talk to about transitioning your care to. So most pediatric facilities have adult centers that they partner with and have alliances with so that they can have a seamless transition as possible. But that may not be convenient from a location standpoint or an insurance perspective. So it's okay to do your own research and to come to your medical team with ideas for yourself. Next slide, please. Okay, so before Diane takes over, she's going to be talking more about the tasks of adolescence. But just to kind of do an introduction to that, we're really going to just take a look at the different changes and phases from adolescence to young adulthood and what we're really focusing on during this age group. So if you look at just adolescence by itself, we're really looking at the formation of autonomy. We have our patients going through puberty, they're creating new friendships, relationships, and really bonding with their school environment and really morphing into small little people. They are learning, more of their personalities coming out, and they're really learning likes and interests. So on a greater scale, we also have our adolescents and teens that are achieving milestones while also living with SMA. And they too have adolescent milestones to hit, such as learning to drive, likely adaptively, learning to play adaptive sports, managing school schedules, ensuring that they have 504 plans and appropriate accommodations so that they have equal access at school, and college planning, and what that looks like living with SMA. And then on a grander scale, when we include, the added component of learning about your healthcare plan, then it can also extend to managing home care providers. Even our young adults or teenagers, I actively encourage families to have their children involved in that planning process. That if you have a home care provider in the home, to involve your young adult or your teenager in the interview process so that they get a feel of the individual that's going to be coming in to care for them. Discussions about advanced directives, learning more details about your disease and emergency management and your medications, and then of course talking about transition of care and doing that preparation. Okay, and now Diane Murrell is going to take over. And next slide. Thank you so much.
Okay, Sarah, thank you. That's really good information for both parents and also for young adults and for adolescents. So I'm really excited to be able to talk to everyone about this, and I apologize. My web camera will not connect or speak with the system that we have here for the webinar, but I'm here verbally. So this particular slide is really just a sort of a highlight slide that summarizes the large area that Sarah was talking about. So when we consider growth in decision-making skills and we look at developing self-agency, the next few slides that I'm going to go through will sort of make that happen and bring it together for you. And when I talk about self-agency, what I mean is you're becoming the primary agent of decision-making for your life rather than your parent being that primary agent. And then when we refer to renegotiating relationships, you know, that's a matter of you're renegotiating your relationship with your parents. You're asking for greater freedoms, but you're also renegotiating your relationship with your providers. And you're beginning to speak, as Sarah talked about, with your doctor, asking questions that you need answers to and not relying on someone to speak for you. So one thing I do like to point out to parents that are listening is this point of invisibility or self-differentiation. So the whole transition readiness is about empowering the young person to differentiate themselves from the parent, to find their identity, to be able to express themselves, to be able to ask questions. And so what we found is that the more that the parent does for the young person, the more invisible the young person becomes. So it's very, very important to empower your child to be able to speak up for themselves. Next slide, please. So just the next couple of slides are fairly brief, and these are what we call the core conversation between the clinic providers and you, the young person. And so those clinic providers might be a social worker like Sarah or myself, might be a nurse practitioner, might be just a regular nurse, or it might be your physician. Anyone can have these conversations with you. And so the questions that I'm bringing to you today are the core questions that most hospitals and providers use to see if the young person is ready for that ultimate transfer to adult care. So like on the first slide here, we've got, tell me about your diagnosis. So that just means, can you tell me what your medical condition is in layman's terms? I'm not asking for the latest research paper or all of the genetics to be explained. Can you tell me when an emergency is approaching, like shortness of breath, difficulty swallowing? What sort of symptoms would indicate to you that you might need to go to the emergency center? And this is a question, if you don't know these answers, these are the questions you're going to say back to your physician. And then, do you know your provider's names? Do you know how to contact them? Do you know the name of the center where you see them? Do you know how to schedule an appointment? And do you know where to go for labs or for any particular treatment that you have? Next slide. What are the names of your medications? When do you take them? How much do you take? So it's not just, do you take the medication by yourself? It may just be, do you know when to tell a caregiver to give you your medication? We want you to have an understanding of it. Do you know what the danger might be of mixing your medication with alcohol or drugs? If there's a danger of mixing your medication with another medication, then that responsibility is on your physician to let you know that up front. And then, do you know how to fill and refill prescriptions and schedule treatments? So these are all things that you've got several years to learn and become familiar with. Next slide. Do you know your insurance company? And what benefits will continue when you transfer to adult-based care? And if not, go to the social worker in your clinic, go to someone in financial aid in your clinic and ask about how to obtain insurance. Make sure that you know what type of transportation will you use to get to and from doctor appointments. Will you be driving yourself? Will a parent or friend be bringing you? Or will you be asking Medicaid transportation to bring you? Next slide. So Sarah mentioned, do you know how to speak to the doctor without a parent in the clinic room? And that's very important. One of those questions you might want to ask might be about sex or birth control. It might be something you want your parent there for, it might not. At age 18, your medical information is private. So do you know that your parent will need you to sign a consent form to be able to receive your test results? And then, do you know how to establish a medical power of attorney in case you need someone to make decisions? So as I said, these are just the core questions. There's a lot of other questions that can be asked, but these are the basics. Next slide. So the next slide is just our little quiz. And if you've got a parent and a young person there, you can compete against each other. There is a maximum of 120 points. And just put down your answer, and then as we go through each question, I'll let you know what the right answer is. So next slide. Okay, what number would you call in an emergency? 311, 411, 1-800-GOT-PROBS, 911, my mom. And the correct answer for 10 points is D. But I will tell you that I have had quite a large number of people tell me that the first number they'd call in an emergency is my mom. So, second question. Next slide. And this question is also for 10 points. What would be a symptom that would indicate you needed to call your doctor or go to the emergency room? Bad case of the hiccups, misplaced your meds, shortness of breath, not sure of the answer to a test question at school, or male pattern baldness. And the answer for that one for 10 points is C. Next slide. Okay, you have someone listed in your phone as ICE. Who is this person? Rap artist Vanilla Ice, actor Ice-T, in case of emergency contact, my personal iced tea delivery service 24/7, or I can't eat, your dietitian. And for 10 points, the answer is C, in case of emergency. So what we tell the young people in our clinic to do is in your cell phone, in front of your parent's name and in front of your doctor's name, just type in the letters ICE. Any emergency personnel, whether they're fire, ambulance, police, when they're trying to find your emergency contacts, they're going to look for ICE in the contact list. I know that nowadays a lot of phones already have a particular swipe where you can get immediately to emergency contacts. But if your phone doesn't have that or you're not clear about it, type ICE in front of your emergency person. Okay, and that also is for 10 points. So next slide is for 20 points. This is a little harder. So what is the word for the amount that you pay the hospital before your insurance company will start to pay for your services? So pick one of those letters there. Which one do you think it is for number 4 for 20 points? Deductible, income tax, copay, ransom, lost pennies. And the correct answer is number A, and you have 20 points for that. And then there are 2 bonus questions for 10 points each. The first bonus question, if you have Medicaid, what is the amount of your copay? So if you wrote down that your Medicaid copay is 0, that's 10 extra points. Next bonus question. Can you have 2 insurances at the same time? And if you answered yes to that question, then that's another 10 points. You can have a primary insurance and a secondary insurance. Next slide. So what does SSI stand for? I'll give you 5 seconds to pick an answer. And this is for 10 points. So if you put D for your answer, you get 10 points. And if you put E for your answer, you get 10 points. And if you really thought about it and it made sense that it would be E, but you knew that the answer was really D, so you put D and E, then you get 20 points. So supplementary security income, a lot of times in the vernacular, people just say, hey, you qualify for Social Security, you have a disability. But what they really mean is you qualify for SSI, supplementary security income. Now, this varies a little bit state to state. And in some states, it depends on your family's income, and in some states, it doesn't. If you have spinal muscular atrophy, I would say that 90% of you qualify for supplementary security income once you turn 18 years old. If you have had SSI before you turn 18, then you're going to have to reapply at the age of 18. If you've never had it, maybe your family had too high of an income or you weren't seeing any real disability, you can apply for it at age 18, and it's a matter of going to your Social Security Administration office and getting that application form, and then that form will walk you through the steps. Next slide. So I think this is a tough one. I think this is a chance for youth and adolescents to get some points over their parents. Who is this doctor? What is his name? And then what type of point was he? Sorry, what type of doctor was he? So there's 20 points for this. Who is this doctor? What's his name? And what type of doctor was he? So the doctor is Dr. Strange, and Dr. Strange was a neurosurgeon. So one of the questions we ask in transition readiness is, do you know the type of doctors who help you? Do you know their role as well as their name? So for example, you might have a neurologist. Do you know his name? You might also have a pulmonologist. You might have a physical medicine doctor, which some people call a physiatrist. Do you know their name? You might have an endocrinologist, an orthopedist. Any doctors I've not mentioned that you have, put those in the chat box so that we can see the others that I'm not thinking of. And then the last slide. So what does MPOA stand for? Miniature Ponies of Angora, very cute on the bottom slide there. Medical Power of Attorney, Marvel putting out another movie. My Personal Organization Assistant, or My Medical Plan of Action. This is for 10 points. Remember, you're building up to a total of 120. And so the correct answer is B, Medical Power of Attorney. And if you could write in the chat box why people need a medical power of attorney, we would really, really love to see your answers. Next slide. I'm not going to talk about why we need a medical power of attorney because I'm passing the baton to our next presenter, Vanessa Batista. So Vanessa, over to you. Thank you so much.
Great, thank you, Diane. So I'm going to talk a little bit now about advanced directives, and I'm specifically going to tell you about a quality improvement project that we did at our center. I work in the neuromuscular program at the Children's Hospital of Philadelphia, along with Sarah Stoney, who started our presentation off today. And so I'm going to show you some of the data and take a look at a study that we did specifically, or a quality improvement project. Next slide, please, Kat. So we originally had to think about what the problem was here, so to speak, or the problem you need to explore something in research. And one of the problems, which is a good problem to have, is that children with neuromuscular disease are now surviving into adulthood. And we know that because most of you watching today are probably adolescents or young adult patients, or people living with neuromuscular disease who have been a patient perhaps since you were a child, but are now surviving into adulthood, which is a wonderful thing. But as this whole session has told you, if you are surviving into adulthood, then we need to be prepared to care for you as an adult. So when you transition from pediatric to adult care, it's really an opportune time to talk about advanced directives or advanced care planning, but we often fail to do this. And when we fail to talk about this, we put people at risk for dying without knowing what your wishes for care may be, or which creates ethical dilemmas and can also lead to unnecessary medical care and costs at the end of life. Next slide, please. So while we know that the focus here is certainly not the end of life, and we hope that many people who are living with neuromuscular disease, all of them, will live very long and fulfilling lives, we always want to be prepared for an emergency that may occur, because we know that it's better to talk about things before we get into a crisis situation, and to be prepared about what you would want your care to be like, and for us as the team caring for you to know what your preferences are, to know what you like or don't like, things that you might want done or not done if you were ever very sick. And so while we don't focus entirely, certainly, on the end of life, we want to think about a time when you may get sick or be in the hospital or not be able to speak for yourself and express what your wishes would be. And so in order to do that, we set out to do this quality improvement project where we wanted to increase the number of advanced directives among the adolescents and young adults that are being cared for in our neuromuscular program. And we did that by using a conversation tool called Voicing My Choices. And there's a picture of the tool that we used here in that slide. Next slide, please. And so with our project, what we aimed to do two things. One was that we wanted to at least increase the number of advanced directives by 50% for the number of people that are cared for in our program. And so from the beginning of the project period until the end of the project period, which was about 12 weeks of time, we wanted to see if we could increase the number by 50%. And then our second aim was to evaluate satisfaction and to talk to the adolescents and young adults that we care for by using this conversation tool to discuss goals of care, and then to ask them after that, how satisfied were you with having this experience of discussing your goals of care with Sarah and I in this particular project at our institution. Next slide, please. And so the first thing we did was really take a look at the literature, and all of it's on there in tiny print, which I won't go through, but just to let you know the four main findings when you really, I did an exhaustive search of the literature and initially found about 250 or so, or maybe a few more than that, articles that really even mentioned the word advanced directives or goals of care in neuromuscular disease. And what we really found is that there were not many. In the end, there were 5 papers that have been published about this. And the summary of the evidence from those 5 papers is that conversations are not being conducted, meaning that we are not, as providers, having conversations with you as adolescents and young adults or family members who are living with someone who has a neuromuscular disease, in this case, obviously spinal muscular atrophy, that we're not having those conversations about what someone would want for their care to be. There's a small number of patients or individuals who actually have an advanced directive or a document saying what their goals of care should be. But we do also know from the literature that patients or individuals want conversations about goals of care and feel a need to have them sooner, and that there needs to be much more research done in this area because there's really a lack of evidence out there. Next slide, please. So what we did was in setting out to reach our aims here of increasing the number of people we care for at our center who have an advanced directive or who have had a conversation about their goals of care, we used the convenience sample, which basically just means anybody who came to clinic during the 12-week period that we tried this out was approached to talk about this. So we didn't target people with a certain diagnosis of a certain age or anything. It was just if you were coming to the young adult clinic where we work on transition of care, which Sarah talked about earlier, then anybody who was coming through that clinic in that time was approached to participate. And anybody who said that they didn't want to participate in the project didn't have to. It was totally their choice whether or not they wanted to be a part of this. Next slide, please. So what we did was we first just got some information about the individual we were talking with. So what was their age, their sex, how they identify by gender, what was their disease type, and the date. So we just gathered some of that information. And then we used the Voicing My Choices document that I showed you a picture of earlier as a conversation tool, meaning we used it as a method to really have a conversation about what someone's goals of care would be. And in that, we chose 6 sections to go through together. The sections are listed on here. And then after we went through the document, and it was really just a conversation about what someone would like, what they would want people to know who are caring for them, things they may want or not want, who they might want with them if they were sick, whether they'd prefer to be in the hospital or at home, and things like that. We then asked them again to rate their satisfaction of having had that conversation. Then when we were done, I documented everything in the chart, so documented what their wishes would be for their care, and then sent each individual a copy, or excuse me, they got the original of the document so that they could keep that for their own use, fill in more of it if they wanted to at any time, use it if they ever got into an emergency situation, or use it as a way to talk to their loved ones, their family members and friends about what their goals and wishes might be. So they got the original, and then we scanned a copy and put it in their chart so that it was documented. And then we also sent a copy of that along with them when they were transitioning over to adult care, because when you get to adult care, they automatically ask you if you have an advanced directive. So one of the reasons we did this project was to really help prepare people for that transition to adult care so that we could take the time to really discuss goals and wishes before abruptly getting over to adult care and having somebody just asking you these questions without being really prepared to think about them. Next slide, please. So this is just a chart that I'll talk about briefly that showed the number of participants who were in the project, again, for this 12-week time period that we looked at it. There was 14 people who came through the young adult clinic at that time, and there's some information about them here. They were a mix of male and female, of white or other races and different ethnicities. They were all English or Spanish speaking, had different education levels, and there was a variety of diseases represented here as well. Of spinal muscular atrophy, the majority of the participants were type 2. Next slide, please. And so here's the results. Everyone who started the project, so 100% of the participants did not have an advanced directive. And at the end of the project, 93% of the participants had an advanced directive. So all but one, actually, 93% represents everybody except for one participant who ended up having an advanced directive at the end of the project. So they would come to the young adult clinic. We would talk about their goals of care using the Voicing My Choices document, and then it would be documented as an advanced directive in their chart. Next slide, please. And this looks at the satisfaction of using that document, that conversation tool called Voicing My Choices. I mentioned to you several times that we used a satisfaction scale to ask how satisfied people were with having this experience and having had this conversation. And as you can see from this chart here, or this bar graph, almost everyone was either quite a bit satisfied or very much satisfied with having had the conversation or using that tool to have a conversation. 8% represented represents one participant who was not at all satisfied. So one person didn't like having this conversation, but overall the majority really were quite satisfied with having done this. Next slide, please. So just to sort of wrap up here with some discussion points, there is a clinically meaningful change that was shown by this project because we had a 93% increase in advanced directives. We were aiming to have 50% and we ended up having a 93% increase. There was also a very high satisfaction rate with using Voicing My Choices as a conversation tool, as you can see from that last slide. And we know from this that adolescents and young adults are eager to discuss goals of care and overwhelmingly are satisfied with having the conversation. And this also leads us to believe that goals of care discussions should be a routine part of care for individuals living with SMA as they enter adulthood and begin to think about transitioning their care to the adult world. Next slide, please. So in conclusion, it is unclear how and exactly when to initiate conversations about goals of care and how to best document personal wishes. But we know that adolescents and young adults with neuromuscular disease, and specifically with SMA, want to have these discussions and want to have them sooner, and that they rely on us as providers to initiate them. We also know that Voicing My Choices is an effective tool in increasing the number of advanced directives among young adults living with neuromuscular disease being cared for in our program, and that overall people were highly satisfied with this experience. We believe that the conversation tool should be included as a routine part of care, and I would encourage any of you that are watching this presentation that have thought about this and perhaps not ever said it out loud or have never had your provider approach you about it to be brave enough to bring it up at your next visit and say, hey, I'd like to talk about my goals of care. Can we have a conversation about this? Because we need to do more education for our providers to be more comfortable bringing this up, but we know that many of them are not, and so we want to empower you to also ask the team caring for you, ask your providers to initiate this discussion with you. So with that, I thank you so much for your attention, and we'll pass it on to our last presenter, who is Dr. Elseek, who will talk to you about adult care.
Thank you, Vanessa, Diana, and Sarah, and thank you to Cure SMA and the many people who are working behind the scene to make this virtual conference a success. I cannot really wait for next year to have an in-person meeting to see you all. Let me start by introducing myself. I'm Bakr Sheikh, and I'm an adult neurologist at the Ohio State University Wexner Medical Center. We do have a very large multidisciplinary team that provide care and works with adult individuals with SMA. The age span in our clinic is between 18 and late 60s. Here are my disclosures. Next slide, please. Here are my disclosures. Next. So you've heard quite a bit about the transition process and its importance for the continuity of optimal care. In the next few minutes, I will take you through the rest of the journey by explaining the adult provider role, highlighting some of the differences in approach to management, and explaining the role of the multidisciplinary team and adult center setting. Lastly, I will provide some take-home tips. Next slide, please. So what can an adult provider do? So an adult provider see patients for both sick and well care visits and can coordinate with other specialties if needed. Obviously, as stated earlier by Sarah, with age comes a new set of conditions. Adult providers will screen and manage adult diseases, to name a few, reproductive issues and mood disorders. While following with the specialty clinics for SMA, you will usually be asked to also establish care with a primary care provider for other medical problems and health screens. Another point to make is once you're established with an adult provider, in the outpatient setting, you will likely be admitted to an adult hospital if an in-hospital care is needed. And your adult provider in that case will serve as your contact person. Next slide, please. So here are some of the differences in approach to treatment in the adult versus the child practice setting. What happens is there is usually a shift in focus from the whole family to the individual patient as an adult. Patients are seen as self-reliant. You will find in appointments that the physicians are directly addressing and engaging you to make decisions about your care. That being said, you are in control. You can have whoever you want to take part of that process with you. So that person could be your parents, family, or a significant other. Another point that's important to keep in mind is tolerance for non-adherence tend to be lower for adult patients. Usually, institutes and practices have strict policies for non-adherence. And for instance, patients might not be seen if they came to the clinic late to the appointment by a specific period. Sometimes if patients repeatedly do not show or miss appointments without notifying the clinic, they could be released from the practice. And so these are some of the rules that are commonly used in the adult practices and hospital setting. Next slide, please. So it's really important through that transition process is to choose a setting that will provide you with comprehensive care. So there are some centers like the acute SMA care centers as well as MDA care centers. Those are examples of some places where you could find such care for adults with neuromuscular diseases and SMA in particular. So obviously settling into a new practice and knowing your new team is going to be a process, and it's going to take you some time to warm up for the team. Keep in mind where you will be meeting a whole new team. In addition to the physician and the clinical providers, you will meet the other members of the team, the social worker, the physical therapist, the dietitian, the respiratory therapist, and others. So really the best care, you will use a multidisciplinary team approach to implement the standards of care based on each individual functional abilities. So those clinics usually implement a proactive care model and work to plan ahead. And that's really the goal of care in that setting. Next slide, please. So another point I wanted to bring is that several of the things that used to happen under your particular radar might come to the surface in the adult clinic world. So this additional knowledge about the system or navigating certain processes will usually build over time, even for the adult patients who start coming into the clinic for the first time in adulthood. I brought as an example the therapies that are approved by the FDA for adult individuals with SMA. So although there is robust data in the pediatric population, the data available for efficacy in the adult is not as robust. And this kind of added a layer of complexity to the approval process for the adult patients. And so it might, and at times we will require engagement from the patient themselves with other entities, for instance, your own insurance company. And so most of the care centers will have point person who could help with that. Similarly, for the reapproval process, it's also complex and require periodic evaluations and monitoring of response to treatment and and clinical progress. And that's why adherence to the visits and evaluations are going to be very important. Lastly, I'm just going to leave you on the next slide with some take-home points and tips. And so come to the appointments prepared. The appointments in the adult clinics, they tend to be a little shorter. A cheat sheet that have all the questions is really a great way to make the best of the visit. Make sure you engage your physicians and providers and ask questions and communicate any concerns you have. Listen carefully and make sure you learned about the subject before you make any decision. You can always ask for additional information or additional time about anything that was discussed and have it in a written format to review it on your own pace and learn to do your own scheduling and navigate the system on your own. And also make sure you utilize all the resources that are made available to you via the clinic. Remember, knowledge is empowerment, and continue to play an active role in your care. And do not forget, in the adult world, you are the one who's in control. Thank you.
Thank you so much, Dr. El-Sheikh, Vanessa, Diane, and Sarah for sharing this insight and this great information here with the community today. We appreciate everyone who's joined in. There's a survey linked in the sessions page, and you'll also be receiving a follow-up email with that survey link. We'd welcome any feedback that you have to share. Once again, we're incredibly thankful for the support from our sponsors for making the 2021 virtual SMA conference possible. Be sure to join us for Friday's SMA Community Conference Closing Social, wearing your virtual SMA conference t-shirt or other Cure SMA gear. If there's anything that we can do for you, or if you have any additional questions, please email us at familysupport@curesma.org. Have a great day, everyone, and thank you again for joining us for the 2021 Virtual SMA Conference.